Well, good afternoon, and thank you for joining us. It's 2 o'clock, and you've landed at the Los Angeles County Emergency Preparedness Updates. These are the DRC updates. Here, let me switch to slideshow because you probably don't want to see that. All right, so hopefully you get the full screen effect there. If you don't see a screen for some reason, will somebody put in the question box or the chat box if you're not able to see the screen? If you are, I'm going to go ahead and keep on moving unless I see some folks saying they can't see the screen on the side. So once again, you've landed at the Los Angeles County DRC updates. It's September 12, 2022, and these updates are as of this date, and it's 2 o'clock in the afternoon. These updates are brought to you by the CAF Disaster Preparedness Program. Our disaster preparedness program is a grant-funded program by both the Los Angeles County EMS Agency as well as the California Department of Public Health. Our speakers for today are actually going to be myself. My name's Jason Belden. I'm the Director of Emergency Preparedness for CAF and the Director of our grants with LA County and the state. Dr. Mary Story may be joining us shortly, and I believe Jennifer Calderon is off-site doing an assessment at a facility, so she won't be able to join us as well. But I do have Tamiza Teja. Many of you have had the opportunity to have Tamiza out to your facility before. You know that Tamiza is a consultant with Mosaic Solutions based in Los Angeles County. Tamiza does an emergency operations plan review. It's a desktop review with each of the facilities in Los Angeles County, and that includes Pasadena and Long Beach public health jurisdictions as well. And Tamiza does a desk review of your emergency operations plan for the low price of free. And so we have this program as a part of our grant. So it's paid for by LA County EMS Agency. It is a time commitment, and we ask folks that want to sign up. The reason why I bring this up is because we can repeat those reviews. So if you would like to if you've had Tamiza come out in the past, but it's been a few years since you've had a review of your ELP, we can reschedule that and do that again. So Tamiza, first of all, can you introduce yourself and say hi to everybody, and then give us a little description of what it's like to go through one of the reviews that you provide for the facilities.
Great, thank you, Jason. Hi, everyone. I am Tamiza Teja, and we've been doing these emergency operations plan reviews since 2016 already. So as Jason said, if you've already had one done in the past and would like me to come out, or maybe you've moved to a new facility and haven't had one done there yet, feel free to reach out to us. We will be going through an established checklist that actually is available from the CAF website. So if you don't want to have someone like me come into your facility but want to walk through the checklist, you are welcome to do so. But we'll be looking at things in your EOP, the different components that you have, look at maybe if you have additional annexes or appendices, and see where all of these different parts in your plan that are part of your emergency management program. And what we find is that there may be a lot of things that we do in the facility that haven't been documented or included as part of your plan. So I'll walk you through what some of those issues might be, some things we've seen at other facilities as well. And then CAF has so many resources, so I might be able to direct you to some resources so you're not starting from a blank page. Definitely don't want that to happen, but it's a 2-hour meeting. It is on site at your facility. With COVID and other infection prevention issues, understand that sometimes we might have to reschedule, and that's okay. Or if you have maybe an office kind of nearby, a sister facility that might have a conference space, we can try and schedule for there too, just so that I'm not coming into your facility if you have any concerns. So we do have a flyer available with information. Feel free to reach out to me, to Jason, to Mary, or Jennifer, and we can get that information over to you. And I think that's about it. Jason, did I miss anything?
I don't think so. And you sold yourself short. You certainly, and I encourage folks to take that desktop review and utilize it, especially if you don't have the ability to have somebody come out and in person. But I think that it's invaluable to have somebody with experience that's looked at hundreds of emergency operations plans in order to kind of help you fine tune, kind of your paper-based compliance. So, and Tamisa is a wealth of knowledge. She was didn't go over her qualifications, but certainly she's got a ton of experience in this arena, and we can't thank her enough for making herself available to do these reviews. So thank you, Tamisa. And I guess before I don't want to I don't want to miss out on, if you folks want to schedule a review right now before we go any further, if you email M Story, so first initial M, last name Story, STORY, at CAHF.org or at CAF.org, and just let her know you'd like to schedule some time with Tamisa, and we'll get you guys set up. So thank you, Tamisa, appreciate it. All right, let's talk to our next slide. We've got some standard stuff we talk about on these webinars. We're going to discuss kind of DRC updates, CMS updates, state updates. This webinar, we're really going to concentrate on discussing the upcoming MERCI, and MERCI stands for Medical Response Surge Exercise. And this will be the one functional / full-scale exercise that Los Angeles County is going to do that allows us to have a partner to exercise with. So we're going to cover that pretty in depth here in a second. And we'll review upcoming trainings and webinars. There's a number of stuff, especially stuff here in Los Angeles County that's going to be coming up. We'll cover that as well. All right, so we cover these generic kind of things, acronyms that we will talk about during the webinar today. AARIP, we'll definitely cover that today, as well as ICS and EOP and a bunch of these other things, NICS as well. Hopefully everybody is participating or is utilizing their NICS binders and things like that. So there are over 400 SNFs, and if you're ever wondering how, where you're mapped out in the county in relationship to the DRC centers, you can pull up a map on the CAF Disaster Preparedness website under the Los Angeles County section. All right, and here's a map of the disaster resource centers located throughout the county. And those would be the disaster resource centers that would support you in the event of a disaster. They also do the HVA meetings, they do the tabletop exercises, both of which you should be participating in. Definitely need to participate in the HVA review with folks with your DRCs, because they're going to be the ones that produce that community-based HVA that you need to keep in at the front of your EOP binder, because you need to do that annually. So so definitely want to attend those DRC meetings. Make sure you're at least attending the one where they do the HVA and the one where they do the tabletop in preparation for the MERCI exercise. All right, so if you need contact information for any of the DRC coordinators, they are listed out here, primary and secondary contact. These slides are included in the handout, so you have all the links and everything like that. So you should be able to get to any one of these folks' information that you need. I'm going to skip through all of them. I won't mention by name and person, but you can see they're all listed out here. All right, so in terms of, I'm not going to do a ton of updates on Department of Public Health. DPH, Los Angeles County DPH had a webinar on Friday, and those webinars are posted generally a few days after they give the webinar. And they talked about kind of changes that were going to be forthcoming, as well as the change to the definition of up-to-date for vaccinations. I don't really want to get into that here because I think they're going to release written guidance. I know the state is going to release written guidance within the next few days as to how that changes the health officer order for the vaccine mandate. So let's say if you had somebody that was vaccinated with the primary series and now they're waiting to get a booster dose, the booster dose now needs to be a bivalent booster, and it now needs to be given 2 months after the primary dose. So how does that conflicts with the health officer's order that says they need to get that booster dose within 6 months? So we're waiting for CDPH to change the language in the AFL, and at this point, I don't know how that's going to change. There was also a number of questions about if you're previously positive with COVID within the last 90 days, should you get the bivalent booster at the 2-month mark, or should you wait for the 90 days? And I don't think there was clear guidance as to what you should do. They did say that the CDC has said there is an allowance up to that 90-day mark, but their recommendation was still to get the bivalent booster at 2 months from your previous 2 months or later after your previous version. So I know it's a lot to swallow, and it's very confusing as to how we're going to operationalize these. My hope is that we have written guidance that we can refer back to within the next couple days. So I'm not going to cover it in depth. I do know there was a ton of questions and answers. They captured that information in the webinar, so they recorded that. I would go to the website so you can at least review the webinar if you did not watch it last week. So. All right, and this, I'm sorry, I'll go back 1 second. This statement here, basically the communal dining group activities, we anticipate that may have some changes as well, but this was the most recent update from July 29th that they had updated. There's going to be updated guidance, written guidance in all of these categories, communal dining group activities, testing, things like that will be coming very shortly. All right, in terms of the KHAN alerts, I just wanted to make folks aware there was a change, or at least clarification, as to when to report MPOX or CRS cases in the facility. And so there was a clarification that there's a requirement to report within 1 working day with either one of these types of cases. And there's a link to the place where you can report the viruses in your facility. And then also, if I didn't mention this, actually, I think I have it on another slide, but there's a spot where you can sign up for these alerts, and I believe I have a link to that. And I want you guys, if you're not getting these updated alerts, go in and sign up. Have multiple folks on your staff sign up, just in case you miss one of these updates. You know, somebody else is catching it in your facility. I want to introduce some guidelines that came out, and this is a big document, this wildfire smoke document. It's called Considerations for California's Public Health Officials. But within that greater document, there's actually a pretty substantial kind of guidelines for how to assess indoor air quality in the event of you're impacted by wildfire smoke. And I know that the last week or so, you know, folks have had some residual smoke, especially in the southern portion of the county from the Fairview fire. And wildfire smoke is not unheard of for facilities all across the county. So it's important for us to understand that there's a bigger focus on not just ventilation systems, but emergency preparedness in general, in our ability to maintain that safe environment of care. So I encourage you to pass along this guideline and have your maintenance staff review the recommendations for maintaining a safe indoor environment. I think what you'll find is they're very similar, you know, kind of process that you go through, you know, with verifying, you know, indoor air quality for COVID. The big difference is with wildfire smoke, we're going to want to try to limit the amount of fresh air that we bring into the building versus maximizing the fresh air. And so there are some commonalities, but there's definitely some differences, and we want to make sure that we're employing the right things at the right time. So, and certainly if you're not being impacted by wildfire smoke, I think best practice is we're going to try to increase our fresh air in our buildings, especially with COVID still around. And then I wanted to make folks aware of this. We talk about NICS, or Nursing Home Incident Command System. Many folks, especially given the last few years, we've not done any trainings on NICS. So we wanted to, rather than force people to attend an in-person session where it's subject to getting things shut off, we've recorded a virtual training session. This is meant to be an introduction to Nursing Home Incident Command System, how it differs from Hospital Incident Command System, but it's based on it. Objective setting in the context of incident command, as well as the entire command and control structure and the things that you have to task people with during disasters. So hopefully you find value in that. It is a long class. It's a 3-hour class. You could cut it up in bite-sized chunks if you want to. But certainly that's a good introduction to NICS, and that'll position you forward into some more advanced training with incident command system. Okay, so here's the KHAN alerts that came out. They created, or I don't know if this is just reinforcing that there's a fillable electronic situation report form, and that should be utilized if you're activating your EOP, or you have some other kind of condition that's going on that you need to notify them. There was an extreme temperature response plan that was developed by Cal OES. And this is another one of those state plans but we can take some of these elements that are built into this and operationalize them in a skilled nursing facility. And so for us, we know that means that in the time of potential loss of power, how are we going to provide air conditioning or cooling in a scenario when it's 110 degrees or 105 degrees outside? Do we have the ability to bring in portable cooling stations or portable air conditioners that we can connect to our red plugs? Things like that. Those kind of strategies are covered in that extreme temperature response plan. But once again, this is for the broader public, but we can pull some of the good data out there or good elements out of that and operationalize them. And then if you ever want to take notice or subscribe to NOAA, you can get forecasts. So when we go through periods like we just went through with excessive heat, you can get updates to where it's going to impact and who it's going to impact. This is also helpful for potentially for your staff and folks like that as well. All right. Oh, I mentioned how to sign up for LA HON alerts. So if you click on that first link, and you just click subscribe, it'll ask you to fill out that information. And the health officer order, when they're updated, that's the link in which they will update the health officer order. All right. Go over a couple of these upcoming trainings and things that are going. I missed putting one of the links for the last training here, but I'll get to that in a second here. So ReadyNet has, if you don't know, ReadyNet is the bed polling and resource requesting platform that Los Angeles County EMS Agency uses to manage disasters for the county. For those skilled nursing facilities, I think most facilities are signed up and they have a login account and they've signed the software license agreement and they're ready to go. We just don't see a lot of people utilizing ReadyNet. So this is going to be a big component of the Mercy exercise, and your participation in the ReadyNet drill will be a part of that exercise on the 17th. So in preparation for that, my suggestion is, if you're not familiar or your staff are not familiar with how to input information, whether it be submitting your status report, meaning, is your facility okay? Does it need assistance? That thing, that kind of information, as well as resource requesting and bed polling information. And so there's a number of things that go into ReadyNet that the county needs to be able to manage a disaster. And especially if we get into a large scale disaster, it makes it really, really difficult to kind of coordinate the finite resources that the county has without having some kind of central point of knowledge of where the resources exist and where they should be deployed. So it's really important that we all utilize that ReadyNet when it comes to exercising or during a disaster. So there's a training on October 27th at 11 in the morning. The registration for the training is that second link there. There's also training videos and a user guide that's available at any time. You can download that. If you already know what your sign-in information is and you're comfortable getting onto the website, you can look at the training videos. And I think you could probably get through most of it. This is not, I realize, these are systems that you don't use on a recurring basis, and so they're unfamiliar to you when you first look at them. But I think they're fairly user-friendly and somewhat intuitive in terms of what they ask you and how to proceed, with whatever the request is. So I want to encourage folks. I don't think it's overly complex, but if the use of it is complex, or you have suggestions to change, please reach out to me. We can talk to the folks at ReadyNet about changing things to make it more useful to you, but we need feedback from you in order to do that. And then if you can't remember your login for ReadyNet, you can always click support@readynet.com, or maybe you're a new administrator and they have a ReadyNet account, you just don't know what the login is. You can email them there as well. And obviously, CDPH does infection prevention webinars. It's actually, I should have changed this. It's every other Wednesday, and they've suspended the calls on Thursday, so they no longer do the calls. So don't go looking for that. And the Wednesday webinars are now every other Wednesday, although there is one this Wednesday at 3 p.m. And our hope is they're going to cover the changes based on the new bivalent booster. And so hopefully we'll have the written guidance before then, and they'll cover it on that webinar. And then in terms of in-person classes, many of you I will see at the wrap session, which is 2 days from now on Wednesday. I'm going to do a brief presentation on active shooter and armed intruder as a preface to our larger full day class on December 1st at the Los Angeles Jewish Home, and that's at their Eisenberg Village campus. That active shooter class, December 1st, is an in-person class. It's going to be from 9 to 12:30, and we're going to do a tabletop exercise at the same time based on the active shooter scenario. It's something we don't practice very often in our facilities, and we wanted to give folks a chance to practice it. But this is not going to be one of those things where we scare you to death with fake guns or anything like that. It's going to be we want to talk about not only the response to an active shooter, but what comes after it. And we really kind of have struggled as a profession to kind of talk about recovery after these events and when they've happened. So we want to kind of build on what our strengths are, but also really concentrate on what are the things that happen after that and how do we recover from an event like that. So that'll be December 1st. My hope is it's the best active shooter we've ever done. The registration is open if you go to caf.org and you click on events. The very last event that there's a registration for right now, I think, is the Los Angeles active shooter, and it's December 1st. So you can register for it now. There's going to be a limited amount of attendance, so we ask don't bring your whole staff. Just, at most bring a couple folks. The attendance is capped at 100 people. We'll see if we can expand the room past that. But I think in order to maintain some semblance of social distancing, we're going to have to cap it at 100. So that means if you want to go, register now. Cost is free. Some light refreshments will be provided in the morning time, but lunch will not be provided. So you have lunch on your own. And then CAF annual conference is November 13th and 16th. If you're going to CAF's annual conference, that same active shooter presentation will be given to the larger CAF annual conference. This will be given on the Sunday prior to the opening ceremonies, and this will be 1 o'clock in the afternoon on Sunday. It is included with your conference registration. But that one, you know, if you're going to the conference, you get to come to the active shooter as a part of that. There is no separate registration for active shooter alone, so you would have to attend the conference in order to attend that session. If not, you get the free session December 1st, which is a couple of weeks after that. So hope to see folks at either one of those two sessions. All right, I want to talk about the Transforming Nursing Homes Together. We have introduced that in a collaboration with the Los Angeles County Department of Public Health. Now, this collaboration is closed. It means that the folks that are participating are already participating. But one of the great things about this is they've created a number of educational materials specifically for IPs in SNFs at the direction and with the guidance of other IPs in SNFs. And so our hope is that they create a compendium of worthwhile documents that you can operationalize. And I wanted to put a link to their website, and that's where they'll collect all of the information and guidance that they're developing and they're teaching to that program. So there's no reason why we can't also obtain the same benefit from that. So we won't be able to ask questions and go through the same kind of thing, collaboration with the public health department, but at least you get access to the materials. You know, pass that along to your DSD or your IP. They may find that very, very, very helpful. All right. I know Los Angeles County came out with the health officer order. There was a bunch of questions on the webinar from LA County, and I wanted to make it clear, this is not a requirement that you have to force people to take the treatments, but you have to offer them the treatment. So it's not, and I don't know who was under this impression, but there was actually multiple questions about this. So hopefully folks know you don't have to mandate that they have to take it. They just have to give them the option to take it, and if they choose to take it, then you have to make it available for them, obviously. So I just wanted to make folks aware of that. It's not a mandatory that they have to take one of the antivirals. So, and then if you want to check the COVID data tracker, we're still in the red, sadly. I don't know that they're going to change the definitions or anything like that. We're still seeing site transmission around the county, enough so that it's staying in the red so far. All right, so let's talk about the Mercy exercise and what it means to participate from not only a practical application of how we do this, but what are the things that we're going to need to capture for us to provide licensing with the documentation they're going to need to see in order to prove that we participated fully in this medical response and surge exercise. So one, there's a participant seminar October 11th, and whoever your evaluator or whoever is going to run your exercise at your facility should attend this participant seminar. It doesn't have to be everybody in your facility. This is meant for the person who is going to direct the exercise at your facility should attend this participant seminar. And I'll be one of the speakers, and there's a handout there that explains kind of what we're going to cover. But I wanted to cover stuff that was more broad for you that as administrators or folks that won't necessarily be the exercise director, or maybe you will, but just know that one person's got to attend that seminar in order to get instructions on how to fill out these forms. The exercise itself will be held on November 17th, and that will be the only community-based functional exercise from a medical health side. There may be some other smaller jurisdictions or maybe a hospital that are going to do their own exercise, and maybe there's a possibility of playing with them. But in general, I'm going to assume that this is going to be your only availability for this community-based functional exercise, which is a requirement from CMS. The objectives for this year, these are the objectives that we came out with. I'll talk about each one of these kind of in depth and the activities that really you want to kind of concentrate on. But in terms of, we're going to, practice activating our incident management team, developing an incident action plan, alerting and notifying our response partners, implementing shelter-in-place or evacuation plans. And I'll talk about how you would pick which you want because it's a choice here. And then resource requesting. How do you submit for resource requests? All right. So in terms of what's the scenario this year, it's going to be a dirty bomb explosion. Choose whether you want to practice shelter in place or evacuation. And so when the scenario is developed and what it'll say is it'll have wording that'll say a dirty bomb has exploded near your facility. And so it's up to you to determine what objectives you really want to practice. Do you want to practice shelter in place with a surge component, meaning you're going to close off all your fresh air, you're going to try to seal up the building as best you can, you're going to try to filter the air as best you can, and then maybe look at surging over your licensed bed capacity to kind of offload some of those folks from the hospital that may be able to be placed at your facility. So that's kind of those are the things that you would think about with surge. Obviously with evacuation, you're going to be looking at where are other beds. Let's say you're simulating, oh, the explosion was close enough where we have to proceed with evacuation, or our medical director says, all it takes is a shift in the wind and we're gonna need to evacuate. So you want to do evacuation. Well, in evacuation, you're gonna look for transportation, you're gonna look for open beds, all of those other things. You're gonna build go kits, develop a staging area, for your folks to get evacuated out, pull out your resident and staff tracking sheets. It's all those things that kind of go with the evacuation side or the shelter in place side. Don't do both, or don't try to confuse yourself like I'm going to practice shelter in place for 2 hours and then I'm going to throw them a curveball and say, oh, the wind shifted, let's switch to evacuation. I don't want you to do that unless you are an expert at practicing and doing exercises. I'll concentrate on one of those two, and then try to see if you can find holes in those two processes. And I think what you'll find is you'll find gaps big enough in either one of those that you don't have to try to do both at the same time. And then we're going to choose those activities that align with either. And in terms of signing up, it's really important that you document that you are signing up. I'm not saying that LA County EMS provides a list of those participants to licensing, but I'm saying that it's not a very difficult thing for licensing to ask EMS and say, hey, can you send us a list of who participated in the Mercy? And they'll have an exact list of who signed up. And so even if you had participated at your own facility, you're going to have a hard time, explaining that, yes, you participated, but you didn't actually sign up for the event with the county. So sign up for the event with the county. That's the very first step. In terms of, we're going to open ReadyNet and use ReadyNet to submit status reports. And then we're going to need to complete a debrief or after action report afterwards. And so I want to talk about for a second, kind of what the forms are. And I'm going to, hopefully I can figure this out and see if I can, figure out how to do this. And you tell me if you're seeing the, please tell me if you're seeing the right screen. All right, so hopefully what you're seeing says medical response and surge exercise evaluation guide. And this is the document, one of the documents that you're going to keep and use during the exercise. And so when we talk about, kind of overarching objectives, these are kind of our objectives: maintain communications, activate EOP and incident command structure, resource requesting, situational status sharing. These all fall under different categories that the federal government has said these are important for every healthcare jurisdiction to practice. So we need to practice foundation for healthcare medical readiness, medical response coordination, and medical surge. Those are the three of the four capabilities that we're going to practice this year. In terms of medical surge, We're going to practice our alerts and notifications. So notify internal and external facility staff that a disaster has occurred and you're activating your EOP. That hopefully makes sense to folks. We're going to notify LA EMS through ReadyNet of facility status. So that's where you log in and you say, yes, I'm okay, no, I'm not okay, or I'm okay, or partially okay, but I can't take any new admits, you know, those types of things. And then notifying HFID or licensing of the facility status. And we're going to utilize our communication plan in order to manage these things. And so you can see as we go down in terms of these targets, we have, these are the tasks in which we're going to practice. Activating incident management team, incident commander accepts assignment, activates the management team, identifies the command center, task logistics with opening command center with appropriate resources. So that's, you know, making sure everything in there is in there that you need to work, food, water, power, computer, internet connected computer, if you're utilizing email and things like that. So all those things have to be in the command center and they have to make sure that that's set up. In terms of developing an incident action plan, the incident commander and planning chief will develop that incident action plan, and the incident commander sets initial operational periods. You'll use your NIC structure to create this. And so as you go on, you can see we have created kind of tasks that is suggested for each one of these folks. Now, these are suggested tasks that I have put in there. It doesn't mean that you have to utilize all of these or some of these, or you can utilize none of them. You're more than willing or able to create your own critical task, especially if you think there's something you're going to struggle with, you can create your own. So this is one of the guides that you're going to keep, and this is going to be your kind of roadmap as to the things that you're going to do within your exercise. Hopefully that makes sense to you guys, that you understand what it is we're going to be doing. And when I say doing, that means you're either going to simulate this or you're going to actually do it. So when we talk about things like implementing shelter in place or search plans, where we identify potential search space beyond licensed bed capacity, if we're going to say we're going to take 20 people from a hospital, and the county reaches out to us and said, can you take these 20 people in your quote unquote surge space, then you would need to go set up that surge space. What does it look like? What do you need for it? Do you have the beds for it? Do you have the ability to give privacy for that area? You know, things like that. So practicing the actually setting up of the surge space could be a portion of what you're doing. And so we'd also want somebody to perform a safety analysis. So where in your building, if you're sheltering in place, where could you have exposure risk from potentially hazardous materials? And so you would want to, you know, have your maintenance director or whoever's going to be your safety officer fill out a form 215, which is the NICS form for a safety analysis, and build that into your incident action plan. Because they may go out there and go, oh man, I didn't know there's a big hole in the wall right here, and I'm gonna have to seal that up. You know, it's things like that. Hopefully those gaps are what we discover when we do the actual work of this event. So you can see, if you're practicing evacuation, you would go to the operations branch, and those folks would start preparing go bags and getting the resident and staff tracking sheets and organizing a staging area. And where does that look? Staging area can't be just, you know, it's what's the temperature going to be when we do this exercise? Is it going to be raining? You know, there's going to be other questions you have to ask of a staging area that may be different based on what the weather is. And so you'll have to operationalize any of those challenges. And then if you go, oh gosh, if I had to you know, evacuate in the middle of a rainstorm, I have no covered area in which to do that. Maybe I should look at buying an easy up or some other kind of temporary thing that I can deploy during the disaster to create some kind of staging area to evacuate folks. So that's an example of some of those things where we do the actual work so that we can identify things maybe that we have gaps in. So we're gonna use this as our roadmap. And then when it comes for, in terms of the evaluator, the person that's overseeing and watching your your staff do the work, they're going to put their notes in here, and that's why it's highlighted in yellow. And then they're going to give a rating, and there's a score down here, a 4-part score of whether they felt that whatever the task was performed without challenges, performed with some challenges, performed with major challenges, or unable to be performed. And so those are the things that we'll concentrate on for our after action report. And so this gives a description of kind of what those things are. So this is one of those documents you're going to absolutely need to keep and use during the event. And so I'm going to try to open up, let's see. All right, give me 1 second. I think it's uploading. Hopefully you guys could see this. It says medical response and surge exercise plan. And so when the documentation is released, you're going to want to keep the exercise plan, which is this document. This is just a draft, but that's this document. You're going to want to keep the situation manual, which is another document. You're going to want to keep the controller and evaluator guide, which is another document, and then the one we just went over, which is the exercise and an evaluation guide. And so those 4 documents, along with the after action report, are going to be what you're going to need to provide proof that you participated in the full-scale exercise. And obviously, if you print off these things and the surveyor looks and sees insert hospital name right here in highlighted yellow, that's probably obviously going to cause issues. I think that's probably the surveyor's going to go, yeah, you may have downloaded all this information, but you didn't go in and fill in any of the documentation. So places where you see it highlighted yellow, that generally means that's where you're going to fill that information in. And so hopefully that this makes some sense to you guys. We're going to have specific guidance for the evaluators, meaning the people that review the work that your staff are doing. That's going to be in that participant seminar. We'll talk about that on the 17th. And so you can see that it's not, I'm going to stop sharing my screen and go back to the slides here, but give me 1 second. All right. So you can see from the documentation, it's super laborious and time consuming to put together what they call an HC compliant functional or full scale exercise. It takes many months to put these things together. And we always talk about, you can do your own full scale or functional exercise. But when we talk about a full scale or functional exercise, it includes all of those components. And it's really, really not as easy as it seems. So that's great if you can pull it off on your own, but generally it's a full-time job for somebody. So hopefully that explains it. And don't have anything else. Let me see if I can get to the questions here. It says I can see the exercise evaluation guide, cannot see the other. So those guidelines that I showed are just drafts. We haven't completed the full thing yet, so I didn't include them in the handouts. They're not 100% ready to go, and I think they've got to put them through some 508, compliance for ADA compliance, and I don't know what all goes into that, but I think they need to put it through some review process in order to put it on the website. But other than that, those materials will be available at the participant seminar on October 17th, and I'm sure they'll post them up on the website very soon after that. But if we can just remember, situation manual, exercise plan, controller guide, and evaluator guide. So those kind of four things along with your after action report. There'll be an after action report that's included as well with the documentation. I didn't cover that, but the after action report should be somewhat familiar to you. It's the same format that we used for the COVID after action report and things of that nature. So that shouldn't be unfamiliar to you. That should be very similar to what you've already done. So let's hop to questions. There's my contact information. If you have or can't remember Mary's email address, you can certainly email me if you have questions or want to get it signed up for a review with Tamisa. Definitely want to do that. And as a reminder, the cafdisasterprep.com, LA County, as well as the YouTube page on the CAF Disaster Prep, or on CAF's YouTube page, we have a playlist for all the disaster preparedness stuff. This webinar will go on that playlist along with the next stuff, as well as all the other stuff we have on wildfire smoke and airborne infection isolation rooms, and you name it. It'll be all in that same space. So if we don't have any other further questions, I don't have a ton of stuff. I will see everybody hopefully on Wednesday. If not, maybe November or October at the Evaluators conference. I will be there. I'm one of the speakers. If not, I'll see you in November or December, but hopefully in the next 4 months we'll catch up at some point. So you guys have a wonderful rest of your day, rest of your week, and we'll see you and talk to you December 5th. Thanks very much. Bye-bye.